Department has vowed to improve inoculation protocols after a video of incorrect vaccination in Makati City went viral on social media. Let's discuss this further with Secretary Francisco Duque III, who joins us over the phone. Good afternoon, Secretary Duque. First off, have you received similar reports of failed jab incidents, and how are they being addressed at the moment?
Well, hi. Good afternoon. In behalf of the DOH, the local government units are conducting an investigation of reports of mis-jabbing or mis-inoculation, but the DOH is also conducting an investigation by the National Vaccine Operations Center. So we're consolidating all these reports, and we will give the results of the investigation. But by and large, the way we look at it, although short of a concluded investigation, it looks like a case of human error due to overstretched healthcare workers and or vaccinators in the centers. So my advice to our people is that every time they get themselves jabbed, to request the inoculating healthcare worker to show the emptied syringe, because it's not going to take much effort to do that. If somebody jabs you, and then you just say, "Can I take a look at the syringe?" And just to make sure that the inoculator or the vaccinator did inject the full amount in the syringe, and that the plunger is pushed to the limit of the syringe.
All right, so noted on that, Secretary. We must check the vaccine site, and as it progresses, we should check if indeed na-press yung plunger. But with regard to that incident in Makati City,
take a picture. Yeah.
All right, so we should actually push for the selfies while getting vaccinated. Now, with regard to that specific incident in Makati, the investigation, I'm sure, includes this incident. Will someone be held liable? We understand that these nurses are overworked, also inoculating as much as 200 patients per day, and that leads to human errors. But insofar as holding someone accountable and liable, how will this work, Secretary?
Well, we leave it to the local government units, no? And in their judgment to decide whether they should just reprimand them as a penalty, especially if it's the first time and no record of misbehavior or misdeeds that are deliberate have been committed. So there is a basis for whatever penalty is to be imposed. There is an admin code where a schedule of penalties is presented, but respecting that these individuals must have due process. Even when somebody files a complaint against them, then the disciplining authority must always bear in mind that these people will have to respect the right to due process.
All right, Secretary Duque, a slightly different topic. The FDA actually reported a number of COVID-19 cases among those who have already been fully vaccinated. Can you tell us more about these cases? Are they mostly mild cases?
Yes, I think they're only just very mild reactions, so nothing serious. By and large, the overall benefit outweighs the risks of any major or serious side effects compared to the risk of getting COVID for an unvaccinated individual, where the risk is higher, and if you are an elderly individual, the risk of getting severe to critical COVID infection is high as well, and may be a real threat to life of the infected individual.
All right.
So the vaccination is still the best protection in the midst of, but in the midst of our still low vaccination coverage, the minimum public health standards will have to be complied with as strictly as one can possibly follow. Wearing a face mask, face shield, physical distancing, and proper hand washing, avoiding poorly ventilated areas. And so these are the reminders we constantly give to our citizens that the use and the compliance with minimum public health standards is really quite protective, no? At least 99, about 99% protection rate.
All right, Secretary, I'm going to bring it back now to our COVID case counts and our tallies. We have the Calamba LGU noting some discrepancies in their COVID numbers on the ground vis-a-vis or versus the figures that were reported by the DOH. What do we know so far about the COVID situation, particularly in Calamba, and how do these discrepancies happen?
Well, maybe the data has not been validated by the LGUs. So the process is that the case count is done via submission of the reported cases in a local government, by the local government unit. They upload this to the COVID Kaya, which is a repository of the reported COVID cases that undergo validation. So once in a while, there's really some discrepancies, but always subject to reconciliation. So at the end of the day, there will always be harmonized data. There's really a process of reconciliation.
All right, understood. So sometimes these are when we notice corrections in the figures as released daily by the DOH. Secretary Duque, I have to ask this. Has the camp of Senator Manny Pacquiao formally reached out to the Health Department regarding the planned corruption probe? And what are your plans on this?
Well, you see, the questions of the good senator are, they're asking if we're ready to show the amounts that were spent for the procurement of supplies such as personal protective equipment, the face mask, and he also mentioned DOH buying a rapid test kits, and I'd like to make that correction that the DOH never buys and never bought a rapid antibody or antigen test kits. Okay, it's the Office of the Civil Defense that buys such. The DOH procurement, which by the way, the DOH does not directly procure, it downloads the budget to the procurement service of the Department of Budget and Management, or the PSBBM, which is the procuring arm of the national government. Not only of the DOH, but even DepEd, the SWD, and other departments use the PSBBM for their procurement, because they're the ones who conduct the bidding until they are able to choose, following, of course, the procurement law. And so I have spoken to Yusek Lloyd Lau, and he's also ready to present the figures and the data as to how the monies or the budget that has been downloaded by the DOH to the PSDBM. Now, the second issue that he raises about where the money borrowed from the multilateral funding agencies went. Okay, where did those monies go? And for the information of the good senator, the loan amounts or the loan proceeds never reached the coffers of the Department of Health, nor did it reach any other government agencies, because it is the funding agency, which is the World Bank, the ADB, and the Asian Investment Infrastructure Bank, that directly pays the vaccine manufacturing companies after all the conditions have been complied with, after all the requirements have been complied with. So there is no money with the DOH when it comes to the loan proceeds used for importing our vaccines.
All right, thank you so much
But
for
we are
parsing.
ready, as I've said in my interviews earlier, we are always ready. I'm just finishing the report, the budget utilization report, which we will send to the good senator.
All right, thank you so much for parsing through the procurement and budgetary process. And thank you so much for your time. We appreciate it. That was Health Secretary Francisco Duque III over the phone. Thank you, Secretary.
Thank you very much, Sean, and good day to your viewers and listeners.
Thank you.
On behalf of the DOH.